Good morning, this is Dr. Doreste with the Cranial Release Technique. It's 10:50 on Monday morning, June the 3rd, 2019, and I came across an article, The Mind and Mental Health and How Stress Affects the Brain. This comes from the Touro University Worldwide website, and I will link this article down below in the description. And I just wanted to cover a few points that are here and then relate it back to CRT in a few minutes. So we begin here with stress continues to be a major health issue according to the American Psychological Association. More than 1/3 of adults report that their stress increased over the past year. 24% of adults report experiencing extreme stress, up from 18% the year before. It's well known that stress can be a detriment to overall health, but can stress actually change the physiology or the functioning of the brain? Science says yes. So let's just go down a little bit and dig a little deeper here. The National Institute of Mental Health defines stress as simply the brain's response to any demand. So given that definition, not all stress is bad. It's simply a response. How harmful it ultimately depends on is intensity, duration, and treatment. Seems like reading this article is a little bit of stress. Stress takes a variety of forms. Some stress happens as the result of a single short-term event. Having an argument with a loved one, for example. Other stress happens due to recurrent conditions, such as managing a long-term illness or a demanding job. When recurring conditions cause stress that is both intense and sustained over a long period of time, it can be referred to as chronic or toxic stress. Remember, in the world of cranial release, we typically talk about constant chronic low-level or many times constant chronic high-level stress. So we'll tie all this up in a little bit. While all stress triggers physiological reactions, chronic stress is specifically problematic because of the significant harm it can do to the functioning of the body and the brain. So then they go on to talk about the leading causes of stress. It's money, it's work, it's relationships, it's all the things that you think it would be. The study found that women consistently struggle more than men when it comes to stress. So again, when you look at the typical holistic practice, regardless, chiropractic, acupuncture, massage, naturopathy, your ideal candidate for a patient is the female, probably between the late 20s to 60s, because they are more in touch with their body and they handle stress differently than men, and they're under more stress typically than men. So again, this might be a good article to send out to all your patients and clients about stress and how CRT can help you with that. But again, we'll get to that in a little bit. So let's focus on the physiological effects of stress on the brain. Stress is a chain reaction. When someone experiences a stressful event, the amygdala, the area of the brain that contributes to emotional processing, sends a distress signal to the hypothalamus. This area of the brain functions like a command center, communicating with the rest of the body through the nervous system so that a person has the energy to fight or flee. So here we are. We know from our previous videos that now we're in the sympathetic nervous system. We're in the fight or flight mechanism. And sure enough, here it is. The fight or flight response is responsible for the outward physical reactions that most people associate with stress, including increased heart rate, heightened senses, a deeper intake of oxygen, and the rush of adrenaline. Finally, a hormone called cortisol is released, which helps to restore the energy lost in the response. When the stressful event is over, cortisol levels fall and the body returns to stasis or homeostasis or back to balance. So then they talk about the effects of chronic stress on the brain. While stress itself is not necessarily problematic, the buildup of cortisol in the brain can have long-term effects. Thus, chronic stress can lead to health problems. And then we're going to just talk briefly, and then I'm going to flip it over to CRT. Cortisol's functions are part of the natural process of the body. In moderation, the hormone is perfectly normal and healthy. Its functions are multiple, explains the Dartmouth Undergraduate Journal of Science. In addition to restoring balance to the body after a stressful event, cortisol helps regulate blood sugar levels in cells and has utilitarian value in the hippocampus, where memories are stored and processed. But here we go. When there's chronic stress, the body makes more cortisol than it has a chance to release. This is when cortisol and stress can lead to trouble. High levels of cortisol can wear down the brain's ability to function properly. According to several studies, chronic stress impairs brain function in multiple ways. It can disrupt synapse regulation, resulting in the loss of sociability and the avoidance of interactions with others. Stress can kill brain cells and even reduce the size of the brain. Chronic stress has a shrinking effect on the prefrontal cortex, the area of the brain responsible for memory and learning. While stress can shrink the prefrontal cortex, it can increase the size of the amygdala, which can make the brain more receptive to stress. Seems like a 1-2 combination. It's not a good thing here. Goes on to say cortisol is believed to create a domino effect that hardwires pathways between the hippocampus and the amygdala in a way that might create a vicious cycle by creating a brain that becomes predisposed to be in the constant state of fight or flight. So it then goes down and talks about the effects of stress on the body, the plasticity of the brain, and understanding how stress affects the brain. So all the things that we've been covering in the cranial release technique is now reinforced here by this article. So I was very, very fortunate to find this. But let's just flip back over to my friends here, the three amigos. So ideally, you'd like to go through life as the man in the middle here. The brain is balanced from right to left hemisphere. When the brain is balanced, the muscles are balanced, the structure is balanced, and that's how you'd like to go through life. When the nervous system is balanced, the brain is balanced, the body's healing, repairing, regenerating. That's the way you're supposed to go through life. Of course, you're going to have your stresses, the physical stress, the chemical stress, the emotional stress, and the EMF, the electromagnetic frequency stresses. And that will do its best to disrupt the brain. And as the stress builds, you will shift into figure number 1 or to figure number 3. In my experience, the majority of people shift into figure number 1. And why do I say that? Because in my experience, I find that the left brain becomes overactive because of stress. When the left brain becomes overactive, the right body becomes overcontracted. So typically, you'll have a high right shoulder, a high right pelvis, and what it will appear to be a short right leg. And as we go down below, right muscle tension, structural imbalance. Now the nervous system is no longer healing, repairing, regenerating. You're stuck in survive, protect, defend. And that's the way most people go through life. Because when most people come to see me, or when I go to conventions and evaluate people, for the most part, they're figure 1. They're typically figure 1, but sometimes they're figure 3. And that depends on your own internal makeup of probably a combination of genes, genetics from parents, how you handle stress, what type of person, you're more analytic, more artistic. It's the same thing that happens just the other side of the body. The right brain becomes overactive. Typically the left shoulder appears to be high, the left pelvis appears to be high, the left leg appears to be short, but anyway you slice it, you're stuck in survive, protect, defend. So with the application of CRT, we find that we take figure number 3 and bring them to the middle, or we find figure number 1 and bring them to the middle. And that's the way you're supposed to go through life, and that can be achieved with regular CRT care, and that's why I would strongly recommend that you find a CRT practitioner in your area. And if you are a practitioner watching this video, wouldn't this be a nice 1-minute hands-on technique, a nice service that you could offer your clients to bring them to this figure in the middle and then do your chiropractic, or then do your acupuncture, or then do your massage therapy, or then do your nutritional counseling, or whatever else it is that you do. So it's a wonderful way to practice. And again, the website cranialrelease.com. If you're a practitioner, you can click on the online training button to learn how do you learn this? How do you learn this 1-minute technique over this 8-module course, which can teach you how to keep people in this middle diagram. It's a wonderful service you can offer to your community. Again, this is Dr. Doreste with the cranial release technique. I will link all the articles down below in the description. Have a wonderful day, and we will be in touch. Adios, my friends.